Welcome to Learn and Go with Laurie at Optimum Pet Vitality. We're in our Optimum Laser Outcome Miniseries. We have looked at treating carpal osteoarthritis and using laser for enhancing workouts. And hopefully by now you have more laser knowledge and understand some of the concepts to have improved outcomes with more efficient treatments. We have this video and one more in our miniseries. But don't fret. After that, we'll offer you everything you want to know about Optimum laser results in my course, Optimum Laser Therapy. It's chock full of information, including research, protocols for multiple lasers, my tips, tricks, and trade secrets for optimum results with any laser. Let's get started on today's journey. We're looking at the chronic tarsal disease that we commonly see in German Shepherd dogs. We see this in other breeds, but it's by far most prevalent in German Shepherds. It is common to see thickening of the caudal aspect of the joint laxity, and frequently we'll find fibrous tissue, pigmented hyperkeratosis, and even ulcerations at the caudal tarsus. German Shepherds are the only breed that lose the ability to extend their tarsus as they age. All other breeds, as they age, lose the ability to flex the tarsus if there's a problem. This stance puts added biomechanical force on the caudal aspect of the joint. Let's start by looking at our goals. If we have ulcerations, we want to treat them with superficial energy to stimulate healing. If we have fibrous tissue, we want to diminish the fibrous tissue for comfort. We always want to break up this tissue or at least diminish it for normal motion to prevent secondary sequelae and then strengthen all the supporting structures to decrease any instability. And then we want to strengthen the supporting structures. That includes the muscles, tendons, and ligaments that support this joint. The muscles that extend the tarsal joint are the biceps femoris, semitendinosus, gracilis, gastrocnemius, and superficial digital flexor. Basically, most of the caudal aspect of the rear limb. This is not an osteoarthritis case. We treat those totally differently. Let's look at our anatomy. We'll start with the bones. The first thing I want you to see is that the common calcaneal tendon comes down and attaches to the calcaneus right here, and that most of the motion of the tarsus happens here between the tibia and the talus. But that's not where our problem is. Our problem is back here, where we have stretch and inflammation in the joint capsule and the surrounding tissue. I put this picture in so you could see again, here's our calcaneus, and here's our tibial talus joint, and the joints where we have our issues. Now the good news is you can palpate these joints so that you know you're aiming right into those joint capsules, and when you're doing that, you're also able to get all of the ligaments on the plantar aspect of that joint. You definitely want to treat those. I put this picture in so you can see the gastrocnemius. He's our calf muscle, the one you can grab. He comes down, the superficial digital flexor is underneath him, but he comes out and they wrap around and they both come down to the calcaneus, and then the superficial digital flexor comes down. Why do I tell you this? Because you want to be treating these tendons as well. They're part of the standing apparatus. So what's the standing apparatus? It's these two muscles plus, let's go higher on the leg, our muscles on the thigh. Now to be a standing apparatus, it has to be balanced. So we have a muscle on the lateral aspect, a muscle on the medial aspect, and one of the two in the middle. So let's start with the lateral aspect. That's our biceps femoris. He's the big guy that you can grab. Greyhounds, you see them huge, right? On the inside is our gracilis. He's our hard-boiled egg. We have all kinds of issues in dogs with the gracilis, so you definitely want to be familiar with him. Then you have to choose between your semimembranosus and your semitendinosus. Can you guess? It's a semitendinosus, right? He comes down lower on the tibia, tendinosus, tibia, and all the way down to the tuber calcanei, right? Now, if you get the semimembranosus when you're lasering, is it a problem? No, of course not. But if you're trying to be efficient and get exactly what you need, you don't really have to get him. He's not a big part of it. When we come down here, I put this picture in so you can see, here's our gastrocnemius, and the superficial digital flexor are part of that standing apparatus. The yellow is the superficial digital flexor. So you can see him underneath there, and then he comes down and comes all the way down. You can treat all the way to the metatarsal pad. All right, let's look at the bones. I want you to see what you can treat. Besides treating over the muscle and the common calcaneal tendon and the superficial digital flexor tendons, We can treat over the caudal aspect of the tarsal joint, as that's where there's a lot of stress and inflammation. The joint lines are actually significantly distal to where some people think the tarsal joint is. We have 3 joint lines, and the plantar ligaments go directly over them. So by treating the joint lines, you're getting all of the ligaments and the joint capsule, which has the nociceptive or pain receptors in it, and at this point are being stretched. This is where we commonly see the dogs chewing. All right, let's look at our anatomy. The muscles that we want to treat with our laser are the biceps femoris, coming down in the most lateral aspect, the muscle right next to him, the semitendinosus, and the one on the inside. If we bring this up and take the tail out of the way, there you go. You can see right here, that's our gracilis. Now, if you just kind of go over all of the muscle, that's fine, but those are the ones that you need to get up on the thigh. Then, as we come down, you have our gastrocnemius and superficial digital flexor underneath him. Again, if you just treat the gastroc, you're getting your superficial digital flexor. So you don't have to worry about that. Definitely come down and get the common calcaneal tendon. All of those tendons come and attach here. When we lift this up and we look, our joint line, or where we have our scar tissue, is going to be back here. So we definitely want to get that. And then follow our flexor tendons coming down here to each of the digits, all the way down to the metatarsal pad.
When I treat with a Respond laser, I would be using the 808 nanometer continuous wave probe with 500 milliwatts or 1 watt over the joint lines with a dose of 6 joules per centimeter squared, and over any ulcers with 2 joules per centimeter squared. I would then switch to the 904 nanometer super pulse probe and treat over the muscles with 2 joules per centimeter squared. If I was using a companion laser, I would measure the area, about 1,500 centimeters squared for the tarsus and about 400 centimeters squared for the muscle area. I would treat the tarsus with a large contact head using 5 to 8 watts and 10 joules per centimeter squared, about 1,500 joules, and then move to the muscle area and treat with 10 to 15 watts at 10 to 15 joules per centimeter squared, about 6,000 joules. I would scan moving my probe at 3 inches or 8 centimeters per second. Or you could use the protocols and select body weight, a deep tissue protocol, pain, trauma, edema and swelling, or arthritis, and then pick both hock and stifle areas. And the software will load both protocols in succession. This would give you total doses adequate to treat circumferentially from about halfway down the femur to about halfway down the metatarsals. In this case, you're going up higher on the caudal aspect of the rear leg and going down to the pads, but not treating the cranial aspect of the thigh, stifle, tarsus, or metatarsus. That would give you about 5,200 joules for a 60 to 80 pound dog and about 6,600 joules for an 80 to 100 pound dog. For any ulcerations, you would want to go over that area in an off-contact manner, same head, but drop your power to 5 watts or less. And if I had a SpectraVet laser, I would preferably use my 904 600S P12 multi-probe with my Pro 2 set to continuous wave. If I didn't have that probe, my next choice would be the 810 2000L multi-probe with the Pro 2 set to 10 Hz. For a 60-pound dog, I would treat 20 to 40 seconds per site and treat 2 to 3 sites depending upon the size of the probe head. If the dog is significantly smaller than 60 pounds, I would treat for 10 to 20 seconds per site. And if the dog was significantly larger than 60 pounds, I would treat for 50 to 60 seconds per site. We should also treat the dorsal root ganglion by treating through the intervertebral foramen from L4 to S2.
Added tips for these cases. We can do traction to decrease pain at the joint, but we only want to stretch the joint capsule between the tibia and the talus. To do this, we can hold the tarsus at 90 degrees and pull straight down the line of the tibia, holding the traction for 3 to 5 seconds. Let's think about exercises that we can use for these dogs. If they're very weak, I would start with goosing from the rear limbs, not the belly, as our goal is to get them to straighten up in the rear limbs, contracting all the muscles we want to target. These are like baby sit-to-stands. We can use cavaletti poles if they're a little bit stronger, as this encourages hip, stifle, and tarsal extension. The longer the stride, the more they are contracting the exact same muscles. As they get stronger, we can use sit-to-stand exercises, but I would not include backwards walking until they were significantly stronger, as this can put stress on the caudal aspect of the tarsal joint. Remember, when we use exercise, we expect to see physiologic change in the muscles in 3 to 4 weeks, but it takes 3 to 4 months to see physiologic change in the tendons and ligaments. We always want to think about the biomechanics of the exercise we're doing and how it affects not only our muscles for strengthening, but also the forces applied to the joint. With time, patience, and perseverance, we can significantly help these dogs. Okay, I hope you had fun. I hope you learned something. I'm Laurie McCauley with Optimal Pet Vitality. Thank you for joining me with Learn and Go with Laurie. See you next week. Take care.